supply chain planning is not just a logistics exercise. It means a lot for a humanitarian actor.
We don't have to reinvent the wheel because the solutions are already available in the private sector.
Talk directly to the actors, to the government, to the ministries, try to engage the communication with them.
Good collaboration, good data, data-driven decision-making, and let's make it happen. Raise your hand if you know what is your demand forecast until the end of the year. So if you know how many goods and services you're supposed to provide to the people that are affected by crisis that you're serving until the end of the year. Don't be shy. So we have some planning experts here. Good. But actually, we were expecting this little mix of smile and little laugh. So that's a little bit what we've been seeing also in our research on supply chain planning. My name is Ada Ushta. I work for Help Logistics from the CUNA Foundation. At Help Logistics, we provide pro bono consulting for supply chain for humanitarian organizations. And we try to turn that into scalable solutions. Today, the format is maybe a little bit weird to you. I'm so happy you're kind of close to us. That's good. We really want this to be a discussion, a conversation. We'll have a little panel session, but at any moment, feel free to come in, give your opinion, talk about what's working well in planning in your organization. So this is really meant to be a discussion and something, very conversational. Good. So what are we talking about today? At Help Logistics and in our Research Center for Humanitarian Logistics and Regional Development, we've been studying in the last 2 years supply chain planning in the humanitarian sector. And what the research is telling us is that supply chain planning has huge potential to make operations more efficient, effective, sustainable. And I'm just going to give you an example. It also has a lot of potential for localization. And that's a topic that my colleague here, Kieto in the room, is looking at through the Thought Leadership Initiative at Help Logistics. What our thought leaders have been saying in the first brief on localization is that localization starts with planning, because it's only the local actors that know the best the demands of their communities, and this is how you can build into more equitable operations and supply chain. However, what the research tells us, and that's a bit what we saw in the raise of hand, unfortunately, is that the maturity of supply chain planning is still quite low in the sector. Supply chain planning is not just about supply chain, right? It's about supply chain program, HR, finance, working all together towards the same goal. And what we see is still a lot of fragmentation, lack of processes, lack of institutionalization. So there's still a lot to do when it comes to planning. We also kept on hearing that humanitarian operations are uncertain, therefore they are unpredictable. And that's something we wanted to challenge, right? And we did a second research recently on demand forecastability, and what we showed is that, demand is actually forecastable sometimes under the right conditions, but you can also use simple tools to forecast your demand. And that's also a little bit what we'll be talking about today, how to make supply chains and operations more anticipatory. So the good news for all of us is that we don't have to reinvent the wheel. The private sector has been doing planning for a very long time, and they're quite good at it, putting it in a very strategic point in their organization. So we just need to learn from what works best, and that could be applicable to us, humanitarian sector. So this is how we will start the session around how to anticipate better, align smarter, and eventually act collaboratively better for our humanitarian operations. I'm going to repeat it again, but the format is really a rotating conversation. So anytime you have something you want to share, please raise your hand, come up with your thoughts. I mean, we really want to hear what everyone has to say here. But I am not alone. And I am very, very grateful to our guest speakers today that are here around me. I just want to mention, and maybe that's why there's not my name over there, that I was not supposed to be moderating this panel. And Shahida Suleiman, who's the coordinator at the Somali Humanitarian Hub, was supposed to be here with us today. She couldn't make it due to visa issues, but I just wanted to recognize also her work in this panel. Around me, I have Rana El Baba, who's the head of supply chain planning at the ICRC, based in Geneva. And before becoming head of supply chain planning, she was a global demand planner, and before that has several missions in the field as a medical planner. On my right, Egid Lalimbunda. He's country director of Première Urgence Internationale in the Democratic Republic of Congo. He's a seasoned humanitarian professional working on coordination of multisectoral humanitarian response in complex contexts. And it's good to know that he's enthusiastic about local humanitarian leadership. And finally, Julien Planchon is joining us today. For nearly a decade, he's been supporting NGO through Nutriset, who's a private sector company delivering impactful nutritional solutions to young children and adults that are severely malnourished. And before that, he was working for 8 years in Nigeria for French private companies, where he gained more experience on international operation and supply chain management in complex settings. I'll be starting with the questions. I hope you're ready. So first, I will turn to you, Egid. You are managing operations in one of the most complex settings currently in the world. Can you share a moment in your experience where good planning made a real difference and a real impact in your operations?
Thank you very much. Exactly, for me, supply chain planning, it's a strategic pillar that defines the readiness of the organization, but also the effectiveness of the organization, especially in a complicated context, humanitarian context like the Democratic Republic of Congo. For those who are familiar with the context, probably you know what is going on, and also because of the setup also that is in place, as you know, not only the insecurity that can affect humanitarian operation, but there are also the geographical area. The country is big, but there are also a lack of good infrastructure as well. So all of those, actually, they are challenges for to humanitarian actors. So for a frontline organization such as Première Urgence Internationale, supply chain planning is not just a logistics exercise. It means a lot for a humanitarian actor. And also, supply chain has a direct impact on the strategy of the organization, because the supply chain can tell you where to go, when to go, and how to go. If you don't have a very good supply chain planning, there is no way that you can deliver humanitarian assistance in such context like DRC. Just to give an example, probably, as you know, there's one part of the country that's under the control of a rebellion currently, and that started in January. So when it started in January, and when we saw that, we realized that the fightings are coming closer to Goma town, which was the humanitarian hub. So we start thinking about how can we plan so that when things, will get tight, we'll be able to continue our operations. So we had to supply all our operational bases in different locations to supply them, so that when the road will close and when we won't be able to access those locations, at least we'll have supplies and items that we can use and continue our operation in those locations. And that's exactly what happened. The town was captured by the armed group. The international airport that connects the town to other locations was shut down. The roads, they were closed. So if we didn't anticipate that, we would have been able to continue our operation in those different locations, because there are still people in need in those different locations. So for me, as I say again, supply chain planning is key, is a pillar, is a strategic for a humanitarian organization. It's not just a logistic exercise. And again, because the access is a challenge for a humanitarian organization in most of the context that we operate in. So for an organization to be ready to respond on time, it must preposition supplies. And for you to be able to preposition supplies in location where people in need are living, you must have a good supply chain planning. And this requires, as you said, actually a collaborative work between the finance people, the HR, the program people, to be able to define the needs and to see how it's possible to anticipate, because we know that interruption, for sure, it will come. It may be insecurity, rainy season, or other circumstances actually that may have impact on humanitarian operations.
Thank you so much, Ujid. And I think that really sets the scene to what's possible, what's necessary, and also the potential for supply chain planning in the sector. Thanks for sharing that with us. I want to turn now to you, Julien. I've mentioned it at the beginning, the research that we've done at Hub Logistics has still showed that there's still low maturity of supply chain planning in the sector. And that is not only affecting the humanitarian organization when they plan, but also everyone down the line of the supply chain. So I want to understand from your experience, what happens when the planning is missing? And how does this weak forecasting, for instance, will ripple through the whole supply chain?
Thank you. Yes, first of all, I just wanted to check in the audience who knows about NutriSet. I see some MSF partners. All right. So it makes more simple. So I will bring the private sector view, but we work with Première Urgence, we work with MSF, and like you present myself, I've been working with NGOs for 9 years, supplying plum peanut. So for those who don't know, it's a ready-to-use therapeutic food that saves lives, to make it simple. And yes, the supply chain is quite a nightmare, and I will start with what is not working. Hopefully, there are things that are working, we will discuss later, but things that are not working that I have seen internally that I can share with you just to illustrate. One example is the therapeutic milks. We also procure and distribute therapeutic milks for children, which are F75 and F100, saving lives products also. And that really rely on raw materials, basically the milks from cows in France. We are based in France. And so the supply is already very short. I mean, there is no extendable raw materials for these therapeutic milks. And our own supplier has an inertia that we call internally of 3 months. It means if we increase, if the demand is increasing, if there is a crisis like there is every day in the world, and now we say that we are in a permanent crisis, I believe it's part maybe of the DNA of our job, it's to work in crisis context. When the demand is getting higher, for instance, UNICEF, who is purchasing a lot of therapeutic milks, we can tell them, okay, we will increase the production capacity. It will take us a minimum of 3 months. So in 3 months' time, you will have the product. So it's already a delay that we are creating. Even if we have anticipated a bit, we are already short. And it happened in 2024, at the end of the year. So we increased the capacity. And then UNICEF came back and said, okay, we will need a bit more. So we increased again, and again, and again. And during the year, they doubled their usual needs. So all our statistics that we used to do, the budget lines that we used to plan, everything was down. And we told our customers, and not only UNICEF, but especially MSF, that we will catch up, we will increase the capacity, and we will come back with the product. And we kept saying that all year long until now. We are in October and we are still not catch up with the delay. So we had to admit there is a weakness in our supply chain. And we had to sit with our supplier that is producing the milk and to find solutions. We'll talk about solutions after. But it's just illustrating the fact that it's is very difficult to forecast. And even with our customer, as a commercial, I spend my time going around in headquarters in Europe, but also in the field, and we'll talk about it later as well. I think it's very a key solutions to go in the field directly to the source of the information that is key, and to collect the right data. And despite having all this information, we have been struggling to procure and to supply the therapeutic meals. That was just an example I wanted to illustrate. And we are internally fighting with our purchase department to purchase the raw materials, purchase everything to be ready for the production. And we are in between the demand chain from customers and the supply chains. But we are in the same boat, and we'll talk about how we can manage to secure those products for children.
Thank you, Julien. I think, yeah, that was a great example of the consequences of the demand forecasting. And sometimes you can have a good demand forecast, but it's just also a question of temporality, and that how that later affects also your production and the private sector supply chain. So that was a good example. We're not going to talk only about failures here. The goal is really to talk about what works and what we can do better. And what the research tells us is that, yeah, demand forecasting is feasible and can bring good results. And the ICRC has actually taken concrete steps to make planning more systemic. Rana, can you explain to us how that works for you and what's the difference that it had made at the ICRC?
Yeah, sure. Good afternoon, everybody. Very happy to be here. And I can relate exactly to what Julien was mentioning. I mean, this challenges with the procurement team internally, but also the challenge of recovering from change of planning and change of forecasting. But as Ida mentioned, let's be very positive. I mean, and in her introduction said we don't have to reinvent the wheel because the solutions are already available in the private sector. So what we did in ICRC, we just simply brought, I don't know if you're familiar with sales and operation meeting in the private sector, SNOP meeting. So in ICRC, we brought this type of meeting in our monthly planning. We call it simply collaborative demand planning. And it's actually a monthly meeting that take place between supply chain and all the other departments within the same site. Health team, they join, the economic security team, the water and sanitation team, all the team that they have need for supplies, they join the meeting, and they have, and also the management joined to give more credibility to the meeting and to push all the other departments to give numbers, forecasts, that they can later on honor. And this number, we use them in supply chain for our to meet the supplies. And in this collaborative demand planning, it's at the beginning it's complicated to set because it's you have to bring people on board and you have to have their commitments. But once it's up and running, it's you have numbers and you can actually work on number. Of course, the numbers can change. We still show flexibility. But also the CDP meeting proved to us that 80% of our program can be planned, and we can only leave 20% for uncertainty, for emergency. And this we have parallel planning for it using contingency stock at our level or at supplier level. Ahead of this preparation for the collaborative demand planning meeting, it's a monthly meeting, we have a bilateral meeting with each department. So we sit with each department who needs support and supply, and we try to see the figures with them and to see the planning not only for the months to come, but for a 12 months period. And then every month we meet and we adjust the number. That's at ICRC level. But of course, we didn't stop here. We tried also to take it a step further, and we went to see what we can do with the suppliers themselves. Like Julien, maybe with NutriSet we didn't do it yet, but I hope it will come. So what happened is we have orthopedic supplier with who we work very closely. So what we did, we set a quarterly meeting with them, and we give them yearly forecast. And in this quarterly meeting, we adjust. And we try as much as possible to honor this forecast and to meet the numbers we shared with our supplier. And this is proved also to be very interesting for us, because our items, our goods that we asked for, were ready on time, and we were very responsive to the needs we have in the field. So we need to do two type of planning at two level: planning internally, but also planning with the supplier. And this will really help the humanitarian sector to become more responsive, of course.
Yeah, thank you, Rana. I think that's a great example of communication internally, externally, and the potential for planning. Doesn't need to be perfect, but it needs to happen. So I'm coming back to you, Julien, and can you share now with us successful stories of joint planning with humanitarian partners? Not yet with Rana, but coming. And lessons learned on these collaborations.
Thank you. Yes, we have the same tool that you use, the SNOP, that I discovered also myself because I was not familiar with it. But the direction of NutriSet is really much more implicated with the operation teams and commercial teams and supply teams. So we know the key questions and the budget lines, which is very important. And from what I learned is that when the budgets are here, when you have a finance like we used to see in the past, for example, in 2023, we didn't need that much of planning. It's easier to make mistakes and to change your line and to change your product and to react to events. But when the budgets are down, it's another story. So we had to forecast better and use that kind of tool is a SNOP. But like you said, I think it's the communication as well, digitalization as well of the information, and try to make the supply chain more simple. So it means going, like I said earlier, directly to the source of the information, directly to the need, and address to the people that are really concerned on day-to-day with these matters. I'm talking about malnutrition because it's my area, but in any area it will be the same. So we go directly into countries like DRC, Ivory Coast, anywhere, to talk directly to the actors, to the government, to the ministries, and to try to engage the communication with them and gather all the partners around the table with partners that are private, NGO, politics, etc., etc. I think that's how it works. And one example is MSF that is working well. They are the only one who managed to give us a planning ahead. Well, they are not the only one, but I want to use this example. They gave us their prediction for therapeutic milks to end the story on my therapeutic milks. And they gave us some orders until next year, 2026. We have orders until July. So this gives us the visibility until July next year. UNICEF is trying to do also the same. We have the same kind of ideas with other customers on other products. But that's very key to plan the production and response to the needs. So I thank you, MSF, for this visibility, because usually our visibility in the business is around 2 to 3 months. That's why I raised the hand for the forecast until the end of this year. Hopefully we have, but let's see, it can change, of course. Just I wanted to explain for other products how it works. We procure raw materials 6 months ahead for a production, and the maximum is maybe 1 year ahead. For example, the sugar, because our products are made of sugar, oil, a premix of vitamins and minerals, milk, proteins, and nuts, of course. So for the sugar, for instance, it's a non-perishable item, so you can purchase it when the market is down, so that's very easy. And we keep it for years, it doesn't move. but it's not the same story for other products like oil or vitamins that can decrease with time. So we plan 6 months ahead to purchase, and it depends also on the market opportunity. When the price is down, that is the time that we should purchase the most. You know how a purchaser think. So we have raw materials in advance, and then it's our job to make it sure that it will go to the field at the right time with the maximum shelf life. Our products are like 2 years shelf life, but it goes very fast because the time for production will take us maybe a month with quality analysis, etc. The time to confirm an order will take another month. The times to ship will take another month. Mostly it's going to Africa. So 1 month, 2 months, clearing. And then there is the distribution, consumption, and we get the payment. So it's a forecast that is about 6 months, 9 months. So of course it has an impact on the prices, it has an impact on the quality of the product and the quality of the job that we are doing. So that's how we work, to give you a bit of illustration.
Thank you. I think it's really good to be conscious of this, right? It's not like you order today, you get it tomorrow, but there's long lead times. I think you've already touched upon a few things that could make supply chain planning better, also in humanitarian organization. I want to go back to you again, Rana, on, can you share with us a few things that could really institutionalize supply chain planning, that can help having better forecasting in terms of culture, systems, skills?
Yeah, sure. I mean, again, there's no magic recipe, right? It's all about changing the mindset of the department involved, that their numbers, their demands will help us plan better for them. So Ada just mentioned that it's not you order today, you get it tomorrow. Sadly, some people still think they can order it today for next week because it's sitting in the warehouse. Sometimes, yes, it's sitting for the warehouse, but it's not for them, right? It's for a different department. So first of all, to have these numbers, to convince people about the importance of demand planning, you have just to change the mindset, and we can only change the mindset by showing efficiency in planning. Like, if you give me a number, I will show you. We'll have better stock availability. We'll never be out of stock. We can have better forecast accuracy for the supplier, so the supplier is more responsive to us. And I think Julien can say, little by little, the relation with suppliers start establishing as long as we have this continuous communication and we give them the numbers. So first of all, changing the mindset of the department that they can help you planning. And also what's very important is to have the buy-in of the management on this, because they are the one who can really give credibility to this SNOP meeting or CDP meeting, collaborative demand planning meeting. Because we have noticed when the management and the finance start coming to this meeting, it had its weight, and people start really preparing and coming ready with numbers, because the management start questioning why we're not ready with the numbers, or why the numbers are not matching the financial aspect of it. Julien also addressed the issue of the budget. And yes, we can plan as much as we can, and we won't, but of course the budget should follow. And we have this change in price that we have to take into consideration. But just to summarize for you, to have this meeting in place, to put it in place, it's all about changing the mindset and the communication and having the buy-in of the management in this meeting. Yeah.
Thank you so much. That's really important points. All right, audience, I don't want you to fall asleep. I still have one question for Ajid, but be ready. You will need to be talking right after he finishes. So prepare in your head what you want to share about supply chain planning, but still listen to Ajid, of course. So Ajid, final question, because it's very interesting what Rana said. You need to have management pushing for this. And for you in your management position, how do you know if planning is actually making a difference in your organization? How do you know that it's working?
It's a good question, actually, because Rama said that we need to institutionalize the supply chain, And for that, the implication of the management, it's key. Because as an organization, actually, we must look beyond the delivery time. The supply chain is not only the delivery time, it goes beyond that. If we talk about the success of the supply chain planning, actually we must look how the supply chain planning strengthens the capability of the organization to be more proactive rather than reactive. And we are talking about humanitarian response because in humanitarian response, actually, there are key things must be you must respond on time, and for you to respond on time you must have things ready, or and we have some constraints, like we're talking about the budget. We talk the fact that you order today, you're not getting it tomorrow, so you need some time. So that's why for me one sign of the success is the collaborative work between the supply chain department, the finance, the program, the HR, and also the cross organization alignment with that, because it's key, and it's a pillar. So I look at how people they work. Like you talk about the example of this meeting, which is key. The people who express their needs and the people who are in charge of addressing those needs, they must sit together and plan together and see what are the challenges that they will face, and when it's possible to get those needed items. So if there is no collaborative work between those the departments and the people involved in the humanitarian project, there is no way actually to have a proper supply chain planning. So, but the another sign of success in the collaborative and is the collaborative and the data driven decision, because in the humanitarian sector we have different layers of decision. We have the headquarters, we have the coordination office, we have the field office, and sometimes we even have the sub field office. So do we use the same data so that when we make decisions at the different levels, so we all have the same data, and that will be it will be easy for all the people involved to adjust and to make a very good decision. That's key, because sometimes we see at the field level there are different information, and then you go at the HQ level, there are other information as well. So it's good actually to have the same information, the same data, so that when we make a decision, whether it's at HQ level or at the field level, so the information is based on the accurate data.
Thank you. I love the summary. Good collaboration, good data, data-driven decision-making, and let's make it happen. Good. Now I have a question for you all. So if you were to change one thing in your supply chain planning now, from what you've heard, general, what would it be? You don't need to stick to my question. If you want to share anything about supply chain planning, please do. Yeah, just raise your hand. We'll pass by the microphone. And our panelists, of course, you can, of course, react to what the audience will be sharing. Yes.
Yeah, this is my name is Emmanuel. I work for a supply chain company, not necessarily the humanitarian aid, but I just have one question to all of you. And I think one of the speakers mentioned that. Have you been able to implement digitization of supply chain in your organizations? If yes, could you just elaborate that a little bit to kind of give us an example?
I can start. Yeah, it's a very good question, because we are all talking about digitalization now. We have it in ICRC in two aspects. We have our own ERP system. We use ERP for all our transactional work, our planning work. Everything is done through the software. And also, recently we start testing on AI to have it checking on demand trends, to see how the demand is going, it's happening across the season, across the years for certain category of item, and to see if it can help us in making decision on what to preposition in each region, because we have our ongoing program, but also we have stock in certain region for contingency response. So we are trying to have this AI model testing the different trend of demands for ongoing program, regular program, but as well for emergency response, and see what we can position, preposition where. We are starting doing that with two category of item only, medical and orthopedic, because we have long running program and we have a very high number of items for these two category. And we are not yet at the phase where we can say it's successful or not. But yeah, I think we are trying as much as can to use this analysis from AI to boost our planning. It's been useful, but then the next challenge now is to convince the management and the users to use them. But that's a problematic for another day, I think.
Okay. Thank you. Thank you.
Yeah, I can give other examples of digitalization. That, of course, we have also an ERP system that we started in 2019. We are still not very happy with the ERP system. Not everyone was positive about implementing it, of course. Now we are more used to use it, so it's getting better. But all departments came one after the other, and the finance department was the last one. And I think it was last year they fully engaged in the ERP system. So it's a very slow process. We have also an internal platform of communication that is called Steeple. Maybe someone you know, to prevent from sending many emails to all your collaborators about news, about everything. We put it on a platform, internal platform of communication that is okay. We have also a tool for projects that is called Fabric. So we have project management through this platform. And what is missing that is key, and I'm asking for it since a long time, it's a CRM, customer relationship management, because having accurate statistics makes the difference as well to feel what will be coming up. That are few examples that I can mention.
Any other comment from the audience? Yes. I love the enthusiasm.
Hello, my name is Kian Amin. I'm a research assistant at a company where we currently develop shelter for humanitarian crisis. And since we're still in development and haven't produced yet, I'm not so much into the supply chain at the moment. But through the research proposal that I'm writing, I still had to put up numbers or research numbers, what we want to produce in the future, and it all seems so, sometimes it seems without a base, since we know the numbers for humanitarian crisis are just rising more and more, and I know the demand is there, but how can we all learn to adapt appropriately? What tools can we use? Which database can we access? And also maybe how can the different fields share their data so we can all learn from each other?
Sorry, what kind of product you were talking about?
It's a shelter for humanitarian crisis.
Yeah, it's at the same time a question and a statement, right? Maybe you want to react?
No, I just want to make a comment actually on that, because for humanitarian actors, our operations are based on the need assessment. So we do assessment at the field level, and which is also key for manufacture. So also need to get in touch with humanitarian actors in the field to know what are their needs and what product is really adapt to the context. Because I'm saying this because I come from Africa, from Congo, and most of the time we see there are some very innovative ideas, but they can't work in a context like Congo. So you need to get in touch with people in the field, or probably need to do assessment to see what are those solutions that are adapt to the context. Yeah.
I can give another illustration with MSF. MSF came to see us with a particular need. It was a kind of therapeutic milk, but for adults. I mean, it's a hyperproteic solution for adults who cannot eat because of an injury or because of a severe disease like HIV or having a severe treatment. So they need a particular hyperproteic solution. They told us their need, basically. And so we sit with them and we discuss with them. We build a pilot in Guinea and with population having HIV, living with HIV. And it was quite a success because it was exactly the product they wanted. But it's their own need that came to us and we say, okay, we will work on it. It took us 1 year to design the product. And I have to say it's quite fast compared to all other products we have been designing. For instance, this one is 15 years of research and other years of evidence, etc., of convincing the actors. So it's another approach. But this product I was talking about, NutriHope, I think it's a real success a real success of collaboration with MSF. Yeah.
Also, don't get demotivated because you will never get it right anyway. But you can be very close because, of course, there's always a risk associated with having an overstock or understock. But what I can say, your problem to see what are the need and where is common platform to check on the need, maybe not only the quantity, but the specification, as mentioned by Ajit. It's a challenge even for us within the same humanitarian sector, because you would think that the ICRC or the Norwegian Red Cross with the German Red Cross, we all know it, we all know what each one of us has. No, that's a sad part. We are working toward that. We are working toward having a platform or at least a catalog where we can share our items and the specification. But to answer you directly to your question, where you can get it, I think you are in the right forum to talk to people, to see what the needs and what would maybe, I mean, as a start only, of course, because there's nothing like written, no platform, no catalog yet coming. But it will come eventually. But you are actually in the right forum to talk to people.
Sorry. Thank you. I'm currently battling a cold, so probably just to bear with my voice. I have 2 questions, if you allow me. I think from my colleague from PUI, from the DRC, because you talked a lot about anticipating, which is quite an important aspect in supply chain. But in a context like the DRC where there is conflict and you want to preposition, how have you been able to work around that? Because sometimes you can preposition, yes, but then you have no access, you cannot go, you cannot deliver. Or you can preposition, yes, but then it gets looted because of the need. So just to understand from you, how have you been able to move around that? Second question is, right now, every room I've been able to move to, we are talking a lot about localization. So how do we also think about localization in our supply chain? For example, my colleague, sorry, I can't remember the name, but how do we ensure that we are also supporting the local market so that there is a vibrancy in that market and we are not importing a lot, but we are also supporting the suppliers on the ground? Because I know I'm coming from the humanitarian sector as well. And I used to work with an organization where we also had supply hubs. We'd had in Lyon, in Dubai, in I don't know where. But eventually we had to stop it because then either the supplies will be sitting in those hubs for a very long time and they would expire, or even they would be so expensive to be able to take it to a country that it will not be useful in the end and it will be a waste. Or coming back to a country like Congo, where I have worked before, you find if the airport is locked, You cannot be able to bring in the supplies, but yet you have people who really will be able to need them, to use them. So how about utilizing the local market and the local supplies to be able to ensure that the products are always going to be there? So it's a comment and a question at the same time. Thank you.
I will start actually with the last comment about the local market, because when I mentioned the context of Congo in January, because we knew that the fightings actually, they will get to Goma and the airport will be shut down. And we, apart from supplying, the deep field locations, but also we did market, assessment in those different locations as well, and not only in Congo but also at the region level. That's why we get to know that it's possible actually to get like the RUTF from Nairobi rather than from France, for example. So, and now we've been getting them from this year, actually from Nairobi. So that's one thing. And then when we were not able to access some locations, actually we had to work with local organizations. And when I say local organization, but those local organizations rooted in the community, including also the government services as well. And we even managed to continue our support to some health centers while we don't have physical access to those locations, but the people living there, they have access to our offices. So they came to our office, they pick the pharmaceuticals, and they go back to their health centers and continue the operation there in the health centers. While as international organizations, we were not able to go to those places, but those people, they were able to move from their location to our offices. This is one thing. And then when you say that, in the case of Congo, of course, you can preposition, some items, and then probably they will be looted. That's something that happened in Goma. Actually, it happened to Premier Regions International. Our main warehouse in Goma was looted end of January, and even all other organizations actually in Goma. That's when they say, where do you position the supplies? Where exactly? That's why it has to be a collaborative working with the security managers, the people into security assessment, to know where exactly you're going to position your items. And most of the time, we also make a mistake to have one common warehouse, while we have different locations where you can preposition the items close to the people in need, close to them, because you know that there will be restrictions. Road might be interrupted. There is no way to move from a location to another one. So you preposition to those locations where it's the items that will be close to the people in need.
Yes, exactly. That's what I wanted to say. And just to illustrate, NutriSet, I did not present it, but it's a group. We are a franchise group of 10 factories around the world. We have one in the US, we have one in Burkina Faso, Nigeria, Sudan, Madagascar, India, Ethiopia, and Haiti, and in France. And one good example of the success story is the quite recent, it has maybe 3 years, the factories that we put in Nigeria. We knew that in Nigeria there was huge needs and huge opportunities. And we asked ourselves where to put the factory, because the nightmare is to enter in Nigeria. All the boats are waiting at the port in Lagos. So where do we put the factory? Do we put it close to the port to have the goods ready? Or do we put it close to the needs that are in the north of Nigeria? And I think we had the good answer to put it in Kano. So we are very close to the needs. And we can still improve, because recently, I think before the end of the year, the manager of NutriK in Nigeria said, okay, but in Kano, there is now a free trade zone where you can put your factory. And you can import the goods and the raw materials easily, faster, through this free trade zone. So we can still improve, and now the factory is moving to the free trade zone in Kano. So that's one example that is working well. And we learned from that at NutriSet, but it's not new. that we have this expertise of putting a factory somewhere where the needs are. And I think we are now in the strategy to develop that expertise and to propose this expertise to different actors who can manage this factory, and to help them just building factories where the needs are. It could be in DRC, it could be in Benin, it could be in Afghanistan, Yemen, but I hope. But in difficult places where you need to be very close again to the needs.
Yeah, I don't know. Maybe I just want to speak for a minute about it. Maybe to tackle a different angle from localization and local purchasing. Yes, of course, if the goods are available, why not? We don't have to, we are near, they can be available for the beneficiary quickly. But sometimes we do choose not to buy locally, even if the goods are available locally, because sometimes the market is already very tight. And the more the demand, of course, the higher the prices. And we don't want to make it higher on the local population for the prices. So we choose to import and to buy from the regional hub or even from the EU market, just not to put more pressure on the local market. But it's in some cases, but sometimes we have to consider this angle as well.
Hello, I'm Noor. I'm from MSF Switzerland. I have a question about planning related to with donor funding issues. A lot of the larger organizations, they're having problems. That kind of fragmentizes the landscape a bit, which makes planning probably a bit more difficult. So an example of that is UNICEF usually being the provider of therapeutic food in a lot of places. But now that burden is now following on individual organizations as well. So how do you see that impacting planning going forward, and what can be done to improve that in a collaborative way? Thank you.
Yeah, thanks, Noor, for asking. It's a very important question, and you touch on something very, very sensitive, especially in the last few months. Before, in the humanitarian sector, we used to plan according to the need. I mean, when we planned according to the need, right? Now we plan according to the budget. That's sad to say, but this is the way it is. You have X amount of Swiss franc, you can do X amount of programs, right? But should not push us back from doing. Should maybe, and I hope it can be like the trigger for all the humanitarian organizations to come together and to split the work in different domains, right? So we don't have to all work in healthcare, right? Or in food distribution. We have limited budget, so each organization can tackle a different area geographically, but in terms of need, in terms of sector. We will get there with this financial tightness on all of us. I think we can do it only this way. There is no other way. That's how I see it.
I think we have time for maybe one last. Yeah, please go ahead.
Yeah, good evening, everyone. Yeah, I just want to thank the panelists for this insightful discussion. I'm Cletus Ebong, the Executive Director of Humanity Aid based in France, especially Bordeaux, particularly. I just have a very short question. I originally come from Cameroon, the southwest region of Cameroon, where there is an ongoing crisis, which is almost forgettable, unfortunately. There are more than 700,000 refugees, and as a humanitarian and non-profit, we think it's important for us to get to those areas and see what type of activities we can do to help those children, especially, and women that are impacted. This is the question. How can we as non-profits channel supplies to these impacted zones where there are militias who attack, and when militias attack, it's difficult for these supplies to get to these people. And sometimes there's a problem with the government. The government accuses the civilians for taking sides with the militias. So this is it's a very difficult situation. Please, I just want to get your take on this type of situation. What could be a compromise? Thank you.
Yeah, I can go first, mate, because it's basically the mandate of the ICRC. It's one word, is negotiation, and you have to be impartial and negotiate with all the parties to allow that the needs, the supply get to the person who needs them. Negotiation with the authorities, negotiation with the armed parties in charge of certain geographical area. And it's nothing new. It's done in many regions where the ICRC is present. And in some region, for example, if I take Sudan, nowadays, it's very difficult to cross, for example, in Darfur or to reach certain area in Sudan. So, and there is different parties in charge, different armed group in charge. So the ICRC will talk to every single armed group and make sure that the demand, the ICRC demand is clear. And then either they give you the go-ahead to go, or either you need to negotiate even more to be able to go through. But this has come at high risk, of course. And sometimes, sadly, we lose colleagues in this crossing to reach this security area, like this area where the conflict is really intense. Yeah. But it's only through negotiation. It cannot be done differently. Yeah.
All right, that was a tough last one. But thank you so much for your comments. Yeah, time to close. Thank you, everyone, for being the most wonderful audience of the day. We've been super happy to share this session with you. Thanks again to all the panelists, Gilles, Julien, Rana. You've been great. And it was really a pleasure to share this moment with you.
Thank you. Thank you.
Thanks. And thanks to AidEx for hosting us. Much appreciated. Thank you, everyone.
Here we are
At AidEx Geneva.
at AidEx Geneva. We just hosted the session. I thought it went very well.
I think it was great. We had great voices, great talks on the topics of supply chain planning, demand forecasting, localization.
It was interesting to see how we had three different voices from three different sectors, right? We had a country level director, we had a private sector producer who's local, but who fabricates locally, and then a INGO representative who's been working on this and also forefront from the sector, all working together.
Yeah, it was great. I think their voices were super complimentary, good interaction, also good questions from the audience. How can you actually know what the demand is? What are the restrictions that you have when you have armed conflict in the area? Anything that you can do when all of a sudden the accessibility is gone? What's happening with the funding cuts? I think all of these interactions were really important, and we had a great stage for that today.
There were lots of questions being asked, that's for sure. So we'll see. Maybe people take something away from it for demand planning in the humanitarian sector.
Yes, let's hope so.